coronavirus is a very new virus, so maybe we're not in a great condition to maybe comment about that. But see, what happens is that if you end up, it's a rule of thumb that if you are survived one attack by one kind of virus, right? So if you again get infected by that same kind of virus, so what is going to happen is rule of thumb. I'm just talking about a handwritten rule of thumb. That what happens is that the chances that infection is going to be brutal is going to be less. So what is going to happen is that maybe the infection is not going to be that that fulminant or whatever you want to call it.
Because
right? But then there is a catch. Right? There is a catch. Now, if the virus mutates, right, and then you catch it, then what happens? Because then this is an entirely new virus. It's not the same virus.
So your antibodies aren't effective.
Yeah. So if I were to put it in layman's term, I would say that you got married to a lady, right? In the initial, where everything was hunky-dory, right? Then she started changing her colors. So what happens to you then? You got caught? So you are in a catch-22. You can't run out, you can't run in. So that's what happens with viruses also. They're typically like wives. They can change.
Well, I think we might have got some really good news, because I think we're going to be told that there is a cure that's available at the Family Dollar store. Is that true?
I don't think so. I think, frankly, the only cure that we have right now for anything is the pain that you're going to get from playing chess with Sasha. Okay, you have to put it on your head, and then put it on your arm, because lifting those chess pieces is really hard. There you go. See, so you need the CBD patch with lidocaine. That makes it work. But it's interesting hearing Dr. Tulla talk. I'm going to ask you a question, but if you can wait a second, let me just quickly talk about the dollar store, and then I do want to ask you a question. First of all, I own the family, or my family owns the Family Dollar Store. We're a sponsor for Money Masters PBS, which is the not-for-profit that owns IBM TV. We're a big supporter of the mission, which is to cut the gap between poverty and financial sustainability, to be able to provide financial fitness and financial education to everyone, not just young kids, which is where it started. Oops. Okay, but to provide financial education really for everybody, because frankly, I didn't get my real financial education. Some when I was in graduate school, some when I was taking a merit badge as a Boy Scout, but mostly when I signed up for the School of Hard Knocks after I got out of school. So let's talk about the dollar store. We ship right to your home, unless you live in a community like I do, which doesn't have mail delivery. So then I have to go to the post office, but that's fun to go down and see the ladies behind the desk, and to see some of my neighbors. But then the second thing is we ship for free if you order over $25 worth of product. We have basically a gift token program, which is like getting gift cards. So for signing up just to become a customer, you get $5 worth of gift tokens that you can use for your purchases. And it's not going to mean, it doesn't mean that you have to buy $30 worth of stuff. Give the gift tokens and to be able to get free shipping. Still buy $25 worth of stuff. We'll free ship, and it will only cost you $20. Anyway, the other thing is that we have over 4,300 products. If you sign up before the end of the month, we're going to give you another $5 worth of gift tokens. If you bring somebody in to become a customer, we'll give them $5 worth of gift tokens and you $5 worth of additional gift tokens over what you get normally. then if you shop online and you buy 3 times from us and you have that stuff shipped to your house, we're going to give you an additional $5 worth of gift tokens. So there are lots of ways to get gift tokens. Finally, when you think about it, we're really doing 4 things, or maybe even 5. And Jim, I'm sure you're going to add. But number 1, you don't have to leave your house. Number 2, because you don't leave your house, you're not going to subject yourself to the people who don't wear masks and therefore are spreading the coronavirus. Number 3, time is money, so you don't have to drive to pick up whatever the items are that are going to be shipped to your house, and you're not spending money on gas. Number 4, basically you're getting products cheaper from us than you're getting elsewhere. As an example, one that the ladies use to get rid of the lines on their face, we have for $4.99. Amazon has the identical product for $67, and they also charge shipping. So it's going to cost you over $70. Why spend $70 when you can get the identical item, identical quantity for $4.99 from us and delivered to your home? And finally, of course, you're supporting the mission of IBM TV because you're supporting the donations we're going to be making, we are making to Money Masters PBS. And one other thing, and that is that through the end of the month of August, we are donating 100% of our product to IBM, to Money Masters PBS. So there you go. So go to the IBM TV website, click on the big, oh my goodness gracious. I forgot to bring my mask. Thank goodness Jim is wearing his. So now we're not going to have any COVID spread through the computer. But in any event, click the green button. It's round, it's nice and big, so that if you're colorblind, like over 12% of males are, you can still pick out the fact that it is a round button. Push the button and go sign up as a customer and start shopping on the dollar store. And with that, unfortunately, I see that Dr. Tulla left, but I'm going to still ask the question, okay? And that is, since Nick said there were over 30 studies that said that masks basically reduce the spread of COVID virus. And do I presume that in Indian Ink, you can ask this question, or Dr. Is it Ahuja? If people in India are wearing masks, hi.
How are you, man? Hi, Lynn. Hello, Jim.
So are people? Is everybody wearing masks in India?
Yeah, most likely yes. So today I have, I have put a just 1 minute. Today I have, write a note on my Facebook that if you don't like wearing a mask, you're not going to wearing a ventilator also.
Okay.
So those are the ones who don't, yeah. If you don't like wearing a mask, you're not going to like wearing a ventilator.
Yeah, that's true. That's true. Yeah. So there was a lady on a meeting that I was on today, a Zoom meeting. Oh, there you go. Okay. And she presented a very interesting statistic. She said in Hong Kong, where they have 7.5 million people in Hong Kong, they've had a grand total of 7 deaths. In the state of Washington, where the population is 100,000 more, so 7,600,000 instead of 7.5 million, they've had just about 1,300 deaths. And obviously, and when they haven't quarantined, the state, excuse my dog.
That's all
They haven't quarantined in Hong Kong like they have in the state of Washington. So the question is why? And obviously, because there's, you know, a high level of pollution, people in China and in Hong Kong are used to wearing masks on the one hand, but on the other hand, you can, I believe, as Nick said with the studies, he was talking about it yesterday, you can attribute a lot of the reason to the low level of deaths to the fact that people are in fact wearing masks over in Hong Kong. So having said that, before Dr. Ahuja, before you chime in, I'm just going to say on the Dollar Store website, we have masks. They are the surgical masks. Okay. And that's the one that Jim, and now I'm concerned, Jim, because you might transmit it over the computer and I'm concerned. But
I'm not going to cough.
Okay. But here's the point. We have them for $25 and you can get a box of 50. So why not just go get your masks at the Dollar Store website? So I'd love to hear Dr. Ahuja's comments.
Thank you. Thank you very much.
So Dr. Ahuja, Lynn wants to know about the mask. I mean, how important is to wear a mask at this point of time?
So basically, you know, from this virus, which we came to know about the pathophysiology of this virus, mainly the route of transmission is by the droplet infection, and the droplet is in the range of 5 to 10 micron in size, and that is transmitted through by talking, by coughing or sneezing. So airborne route is not a major route of transmission unless and until you are not working in the ICU. Second is rare route is by fomite, that is by touching the surfaces. That is also very rare. Even recently CDC has emphasized that the main route is the droplet infection. So in that preventive way, the mask play a major role. So if you are wearing a mask, so you are not only, if you are COVID positive also, not only you are preventing others to get infected, and if you are healthy and non-immune, you are also preventing yourself by getting infection from outside. So I think masks play a major role. So I don't think so that wearing a 2 rupees or very cheap mask will cause any major problem for anyone. But definitely yes, the people of all around the globe are not used to be wearing the mask. You talk about the people of Japan, that they used to wear the mask. That is why in the initial part of we have looked into the COVID epidemiology, that they have very well control of this pandemic because they wear the mask. The society, we don't wear the mask. I mean, those are the ones who are suffering. By wearing mask, suppose I am the earner of the family, I am getting out of my home, and if I don't wear the mask, definitely those who are inside my home, they will also get infected. So just a very cheap mask that will play a key factor in preventing the spreading of this virus. To mitigate this virus, I think that's a major play. Apart from that, social distancing and all, country like India, where the maintaining a social distancing is not so easy. It's quite difficult.
Yeah. Yes.
So because population of more than 2 crores residing in the city like Delhi, it's very difficult.
Yeah.
But yes, sometimes you are in the hospital escalator, and a lot of people and even the patients also getting along with you. So how you cannot say that please maintain social distance. In that scenario, I think the mask may play the key role.
Yeah, got it. Got it. It was interesting. The lady showed some statistics of different kinds of masks. And the ones that have the breathing things on the side, people were grabbing those. But apparently, those allow the droplets to be expelled. So it has to be a solid mask. The second thing that she showed was a statistic about a cloth mask. And cloth masks basically have a very low level of basically containment as well, so that it goes right through the cloth. And you know, I'm so glad I got the surgical masks versus, because my wife had made us cloth masks, and as it turns out, what this lady said, they really are not very effective. So
you cannot get a cheap mask at Lynn's family store, but dollar store, but you can get inexpensive ones.
Yeah,
I like the way you put it, Jim.
And Lynn, also our viewers would like to know that apart from masks, do you have those shields on dollar store? Because a lot of people are wearing those shields as well to protect themselves after a layer of mask.
Well, unless corporate added the shields, I haven't seen them on the have you seen them on there, Ankit?
I'll just check it out. I'm not sure.
I don't think
glasses helps. So
well,
if you go outside, wear sunglasses.
Yeah, the problem, of course, is that the glasses, the droplets can go around the outside. What Ankit is saying, this lady did talk about the shields,
yes.
and it was interesting because even though there's sort of a bias by a lot of people now buying stuff from China, she said by far and away they're the best because they have, well, first of all, they have a cushion around your head. Certainly they're open on the side and they're open underneath, but they are much clearer than the ones that are made here in the United States. And they're also cheaper. And so she said that the Chinese make the best shields. We don't have them on our site, but that's absolutely something that I will talk to the people at corporate about doing. Anyway.
So, Dr. Ahuja, how important is the shield during this pandemic, and especially in India, because the cases are spiking up and people still have to go out to buy a lot of groceries and a lot of important tasks to be done. So, do you recommend to wear shield now?
So basically, apart from the two interventions which already been discussed, that is the social distancing and the face mask, shield will, I think, play a major role in those situations like in healthcare professionals, those who are getting exposed to the aerosol generations, where you cannot predict that patient who is on nebulization and generating aerosols, very small particle size, less than 5 micron, 3 micron. So in that situation, that will play a main role. Second, in the crowded places, definitely the shield will play a major role. And the third more important, the very important scenario is when you cannot wear the mask, you are maskophobia. That's just like, claustrophobia. In an enclosed room, there's a maskophobia. So in that scenario, people have the feeling that, I'm going to die. A feeling of pending doom.
Yes.
In a feeling of pending doom with a mask, well, I think that the patient who don't want to wear the mask, it's better to have the face shield.
Yeah.
Okay.
Yeah. In that situation, you can have. Otherwise, I don't think so. In a routine, wearing the face shield will. Yeah. Fourth, more important, very important. Yes, where face shield can work, where mask cannot be fitted exactly in a nose to covering the chin. That is in the children, because in the kids, when they will plan to go into the school, because they can't adjust their mask, but they can adjust their head, simple cap like face shield. So in kids in the future going to the school, I think the face shield will be very convenient for them, and there will be no feeling of congestion in the kind of phobia because of the mask.
And it would look.
I think
it would look.
But Dr. Ahuja, I'll tell you something. What happening in India that we are running a petition against schools. That if there is one patient surviving somewhere in India, we are not going to send children to school, because the children, they don't understand social distancing and all those things. And
that's what I'm saying. That
basically,
you can tell children that you have to make your hand clean, but how many times they're going to make their hand clean? How many times?
Yeah.
If the mistakes are being done by the person who is aged 30 years, 25 years, 40 years, then how can we expect that they can follow all the rules and regulations, taking care of their hands, taking care of these cough etiquettes, taking of their sneezing etiquettes, and then wearing the mask also? I don't think so that they can, you know, manage all these things in a duration of 4 or 6 hours in a school. So it's better that face shield can be there, and instead of plain mask. And yes, if somebody is getting sick, I would say that better to stay at home. Yeah.
So, and Dr. Ahuja, where do you rate the current situation of India right now? Because cases are spiking up since the time we spoke last, and you were also not feeling well since couple of weeks. So, what is the situation of your health, and where do you rate the current situation in India?
Yeah, situation is really getting grim these days. The cases are rising exuberantly. You know, every morning you get up from the bed, you come to know that more than 20,000 cases in your own city. And again, same happening in the Mumbai, another major city of country. So cases are rapidly rising. And even I think recently the WHO has said that within few days we're going to see a 1 crore, I think, number per 1 crore, 1 million number, I think,
1 million
per day. So,
1
million, yeah. So I think the numbers are rapidly rising. So, but according to one recent study, I think I have read it recently also, if the 43% of the population will get affected, that will be sufficient to impart the herd immunity. So I think from the phase of the lockdown, we have come to the phase of the the immunity, the herd immunity, to where most of the people will be affected, and I think that's what we want. That if the patients are being affected and um, the we have developed the herd immunity, that will be the key factor. Yeah,
one of the things
role we want.
I was thinking,
and also Dr. Ahuja, that right now we are also facing a monsoon season right now, and then there are a lot of disease and a lot of like viruses also attack at this point of time. So do you suggest some kind of vaccine for everyone, so that at least they will cover, or maybe they get those antidotes to maybe taken care of for all other viruses, and also that helps in bringing immunity, and because if suppose someone is suffering from fever due to some other reason, so that person already have less immunity, and then that person can suffer from COVID as well. So do you suggest to have a vaccine before that monsoon season started?
Actually, the monsoon season in the India is a independent risk factor for the fever under evaluation, because the moment we have the monsoon season in the July or August part of the year, we see a lot of infection from the tropical diseases like dengue, chikungunya, malaria. So those who are coming these days in the hospital, we admitted them with a label of suspected COVID.
Yeah.
Once we have the rainfall, that will be the biggest problem for us. We have to, admit under fever under evaluation. We cannot label as suspected COVID, because that fever can be a, COVID along with the other infections, or it could be isolated tropical infections. So we cannot put suspected COVID patient with the other tropical infection, because that will be a cross contamination or cross infection within a hospital who is dengue positive, and we are putting them along with the suspected COVID. That will be the biggest threat for the our community. So in that scenario, I'll say that definitely this rainfall will have a major impact in the next few days. So we have to be cautious. We have to depend upon our point of care test labs like dengue kit test, malaria kit test. The moment we have the patient in the emergency department, we have to rule out dengue and the malaria immediately. And then only on basis of our clinical suspicion, we have to admit them to the hospital with the label of suspected COVID.
So do you suggest that influenza vaccine during this time?
Vaccine, I don't think so. At this time, vaccine will have any difference, whether we'll have the vaccine right now or maybe after 2 or 3 months or after the monsoon, because the vaccine will help in further promoting the herd immunity. But the point over here is whether we have the appropriate vaccine right now? I don't think so that we have this answer at this moment. We don't have effective.
But Dr. Ahuja, I'm talking about vaccine which will fight against dengue, malaria, and all those things. Influenza or something which.
Vaccine against? I didn't get you. Please come again.
Vaccine against malaria, typhoid, and.
Oh, no. So malaria vaccine, which is under trial in the African countries, not been approved in the Indian continent. And the another part is that the dengue vaccine also, the studies which have shown that it has been effective in those countries which have this IgGs, immune serology IgGs prevalence of more than 70%, 65 to 70%. In that continent, it's effective. So there are certain regions of the African countries which has been shown to benefit of the dengue vaccine. The company which is Sanofi Aventis, which have made the vaccine, that's dengue vaccine. So effective to some extent in those countries, but I don't think so that will be good effective strategy for our country. So for our country, if we talk about that, definitely the preventive measure in the form of a larvicidal and not allowing the stagnant water to grow these mosquitoes. And the second most important thing is that we don't want that these two fever, the fever of the COVID and the fever of the tropical infection, to come and go in the same hospital. There should be screening center outside of the hospital. If the patient is COVID negative, and now we have the COVID antigen test. So all the tests, whether COVID antigen test or tropical infection, dengue test, malaria test, can be done within half an hour outside the hospital. Or satellite centers. We should have a satellite centers. We are lacking the satellite centers in our scenario. But if we have the satellite centers, that will be a good boon to our hospitals. That we can only refer those patients who are sick and COVID positive to the hospitals.
I have a couple of two things to say. One is that I am only a doctor on TV. So I was under the impression when this first started that when temperatures got warmer, the virus would not like it and would be diminished. However, you're telling me in India, it's still a crisis and your temperatures are tropical. Your temperatures are over 100 degrees Fahrenheit. So I think that the heat that I thought would be helpful is not making any difference at all. I wanted to know first, was that correct statement? And my second question is, and Kimberly is not here, unfortunately, but she's here in spirit. And her spirit told me to ask, why aren't we building COVID medical centers? There are just COVID patients all around the globe.
So can you please come with the first question, please?
Yes, my first question was, I thought in my ignorance that if the temperatures got hotter, the COVID virus would not like it and would go away, and much like the flu seems to do. But that has not appeared to be the case at all, from what I'm gathering from what you're saying. Your experience in India.
Yeah, so regarding the temperature point of view, the COVID virus, which we are only thinking that with the rise in the temperature, we want to see the decrease in the number of cases, because COVID virus will get away with this increase in temperature. But the temperature of your body, you might be sitting in non-tropical country, and I may be sitting in the tropical country. But if you measure your temperature and I measure my temperature, that will be 37 degrees. So I don't think so that will make any change temperature. It might be the outside temperature is variable, but inside our body it's a constant temperature, 37 degrees Celsius, with the variation of plus minus 1, 2.
Right.
So that will not make a major difference in terms of transmission. And regarding your second question, that why we are making the COVID centers, COVID medical centers in our country. Well, the infrastructure, if you talk about in our country, it's not so much of suitable to cater people in where lakhs of people have been infected. If you talk about our Delhi, now we have been seeing this huge spurt in the number of cases. Daily, on an average, 20,000 new cases are coming, 15 to 20,000 new cases. I can make sure that out of 20,000, only less than 1,000 are sick. But can you imagine the city of 400 to 500 ventilator only? And we can manage those 1,000 patients that is arising per day. We cannot manage all those patients.
Right.
So for that point of view, we need to have the certain, separate COVID centers where we can manage those. Also, because of this non-COVID, so those hospitals we are not catering the COVID patient earlier. They have been designated with the COVID. The problem which is arising these days is the patient of cancer, patient of myocardial infarctions, patients of, other diseases, chronic diseases, pancreatitis. They are come to illness just because of every hospital these days are catering the COVID. So it's a totally, it's the right to live, right to health. So the patient who is COVID positive has equal right. The patient who is having the acute pancreatitis, the patient who is having the tuberculosis, the patient who is having the HIV, the patient who is having the cancer. What about those patients? The government has clearly mentioned that all the patients are going to be, all the hospitals are going to be COVID positive. But why this, we can't manage the non-COVID patients. People are getting to the hospital for cancer treatment and getting exposed with the virus.
But my thinking along this, I think Kimberly's thinking was if you had a COVID medical center, these people could be treated in the hospital without overrunning the hospital's capacity to serve and all those other issues. And you would also separate tropical diseases like dengue and have just the COVID problems dealt with in this separate facility.
You're absolutely right, boss. That's what I'm saying, that the hospital needs to be separate the two entities, the tropical infections and the COVID one. But the patient who is coming with a fever, who doesn't know that the fever is because of the COVID positivity, because many of the patients don't have the sore throat, don't have the cough. So how you can differentiate between the two kind of fever? For that point of view, I would say we need small satellite centers, and for that satellite center, that is, we have a POCT lab, the point of care test labs to be there.
Yes.
We need to go for certain testing, antigen testing of the COVID, antigen testing of the dengue, NS1, and the malarial antigen. By doing a test within half an hour, we'll come to know that what kind of infection it is.
Yeah.
So I'm hearing you say that testing is important.
Yeah, definitely, yes.
Obviously.
But if we don't go for testing, if we miss the first step, how are we going to succeed in that 10th step?
Yeah.
And testing also can help you in prevention of those diseases, because we are talking about cure and vaccines, but we have to talk about prevention as well, because prevention is always better than cure. That's what we learn from our childhood. But nobody is talking about prevention. Everybody is talking about vaccine and immunity and things like that. But if we try to wear the mask, do the right precautions, and follow our doctor guidelines, we can still ourselves survive during this pandemic. Because people who are still struggling, they have to go out. They still don't have any options. I mean, they have to go out at any point of time. So that's what I mean. The concern is we have to listen to our doctors and keep following the right thing. And that is what the pandemic era is all about, basically.
Yes.
One major problem is with our country is, all are not well-to-do with family, and those who are daily wage workers, those who are struggling on a day-to-day basis, they keep on, getting infection in terms of COVID also, influenza also, as well as, the other tropical infections. Because there is a lot of mosquito breeding when the rainfall starts.
Yeah.
So in our country, many of the patients goes undiagnosed because of the influenza also. So how to go for testing of the influenza? In our country, we have the influenza PCR. That takes another 4 to 6 hours to get tested. Many of the patients would never go for the influenza testing. It's a costly investigation. So in that scenario, we have to be a little bit, the proper thinking that in mind that any patient with influenza-like symptoms, ILI, influenza-like illness, we need to treat them on a first hand with oseltamivir, along with, if the patient comes out to be COVID negative, we keep on continuing oseltamivir. If the COVID is positive, we have to stop the oseltamivir. We have to treat him on the lines of the COVID positivity. But we cannot wait for the result to come. By the time the result will come, then we'll lose the patient.
So, Dr. Ahuja, there is one more thing. I mean, on the news and on the videos, what we are seeing is that whenever they showcase a facility where we have COVID patients, the COVID patients are not wearing any mask while their treatment is going on. And at one point of time, in one big hall, there are 5 or 7 patients. So, is it something which is with the protocol, or or do you suggest that they also should wear masks during their stay at hospital?
I think the mask wearing should be a compulsory. It should be in our guidelines that wearing a mask for everyone. I mean, if you are healthy by now, you have not been infected. Even then, also you have to wear the mask. And even those who have been infected, who have been treated also, who are now immune, then also they have to wear the mask. Because a recent study have come up in the Nature publication that after the 3 months, the neutralizing antibodies are almost nil. It means that after 3 months, there can be a chances that you can again catch an infection. Just like influenza. Influenza doesn't mean that once a time you have the influenza, you cannot catch the influenza another time. Because there could be change in the strain. That could be the possibility with the coronavirus also. We are so new with this virus. We don't know the exact nature of this virus. We never know that after 6 months, after 1 year, how he's going to play with us. So we have to be cautious. Definitely, yes, it's a painful situation for us that we are changing our day-to-day practices, that we are wearing a mask, we are wearing a cap in the hospitals, we are wearing it in large bowels. But I think with the passage of time, this will come into our, in a tune that, yes, we have to wear all those things. We have to take care of those things before we get up into the, the moment we step out of the hospital, our home, we have to be with our mask. So what I did is, the moment I enter my home, there is a hook is there. I used to keep my mask over there. Where I used to, hang my keys. There I am hanging my, mask these days. Because when the moment I stepping out of my home, so I need to take my mask. I don't want to forget my mask. So we have to change our practices, habits.
And that's
one more thing I was realizing that we are talking about mask, but we also have to talk about changing our mask at certain point of time, because you can't use the same mask for lifetime or maybe for 7 days or 10 days. So the change of mask is as important as wearing a mask. And also, do you think that either the mask should come with an expiry date, or else if you started wearing a mask, you should put a date so that after this date, you have to scrap it and buy a new mask?
So even for that also, what I did is, I don't know, I may be wrong. So what I did is, I have read about a little bit that the virus is going to stay on the fabric or on the surfaces 4 to 5 days. So I have one row of the mask, 1, 2, 3, 4, 5, 6. So I keep on changing, and with each I keep on moving forward. This is how I'm doing it. Because I cannot get a new mask every time, but I put them to few hours. Yeah, this is my
so that is and so Tim and Len and Sasha, that is Dr. Jatin Ahuja's photo. While he's in the hospital, so this is the photograph. That's how doctors are treating right now at the hospital. And after the photograph. You can see the hands, what happened to the hands basically.
So these are the typical pruny fingers, a little bit of image to kind of, you can say, immersed in the water and getting, erosions over the hand. This is typical pruny fingers which we see when we put our hands for long duration in the water.
Well, in the divided states of America, we like things simple. But what I'm hearing from you is that it's complicated. But the simple thing that we can do is preventative. Wear masks. Socially distance.
So here's a question. I see people in their cars wearing masks in their cars with the windows rolled up. Is there any particular reason why people should be doing that?
Yeah, I have asked this question to many of my colleagues also. Even I did this to me also. Obviously, this is not a right thing. Your question is absolutely relevant over here. The problem is the moment I told you the moment I step out of my home, before I reach my car, I put up my mask because I never know in my parking to whom I'm going to meet, to whom I'm going to meet,
Yeah.
to whom I'm going to meet when I'm going to get out of my car, get inside my car. So it's better to have the mask till you reach inside your car. Once you are inside the car, clean your hands, and then just you can remove the mask safely.
Yeah.
And also, Lynn, on the other hand, if he thinks about positivity, then there's a saying that practice makes men perfect. And if you start wearing mask, we have a practice, and then we can wear it at any point of time. Because you won't believe, we were wearing mask when it was 110 degrees Fahrenheit in Delhi.
Wow.
So at this time, we have to wear a mask because you can't remove mask at that point of time. But because of so much of heat and temperature, and still, you have to have those practice going on, and that is what happening. And I'll tell you something. It's not about heat. So there are a lot of places in India where they have heavy monsoon and heavy rain going on. People are still wearing a mask because it's not that if there is rain you can't wear a mask. So it's droplets of rain going around. Mask is all wet, but still they are wearing a mask because mask is something which you can protect from those spreading of things, and rain helps in doing that. So suppose if there's a spread going on, if there is a rain, so it's 5 or 10, I don't know how much percent chances improve to have more viruses and containment. So, but you have to keep on wearing the mask again and again. That is what the practice is all about.
Okay, got it.
So, Dr. Ahuja, before we sign up, what's your tip for our viewers around the world? It's happening in India, but a lot of places they have opened up the economy and things are pretty much better as what it was earlier. So what do you think, where are we heading towards?
I think almost all the things have been opened up. The only things which have been left so far is the kids' school, and which I can also anticipate maybe in the next few months after August or September. We can see that thing also, that we are seeing our kids going with the face shield to the school. Maybe we can, to manage the social distancing, we can see that the half of the kids are going in particular time, half of the kids are going in another particular time. Because these things have to be done, because social distancing we cannot expect from the kid of the 5 years or 10 years. We cannot expect them. But yes, at the same time, we can reduce the strength of the class. We can make it half or 1/3, or we can also do that. Half of the kids can come on alternate day, half of the kids can come another alternate day. So those things needs to be seen in the next few months. Yes, economy has to be rise, and already we have seen a lot of damage to our economy, financial damage, and not our in India. If we talk about it, it's been seen all over the globe. So we cannot sit idle and wait for the when is this virus going to be end, and this virus isn't going to be end. We have seen that even with stringent lockdown, we are seeing the large number of cases. So it's high time we have to come up, and being a country of the youth, maximum youth population is their age of less than 40 years, most of the population. We have to come up, we have to acquire the immunity and keep rolling the cycle of the economy. That's the thing which I need to.
But Dr. Ahuja, on the other hand, what I realize is that we can do online shopping, we can play chess online, we can meet online, we can watch movies online, we can, in fact, doctors can also do telemedicine online. So we can also encourage people or students or teachers to create an online curriculum, especially during the pandemic, because children have a future. Because if you know that if one children is suffering from something, it will impact the whole generation. And I won't be sending my kid to a school till the time we don't have any cases. I have decided that if it's a matter of 1 year or 2 years, I'm happy to do that, because health is not.
It's not only you, Ankit. The same applies to me also. Even I don't want to, make a scapegoat of my children to become a scapegoat and getting into the school. They are not preparing for any, any hard thing like becoming a doctor right now. They are just in
Yeah.
a very getting a primary education. So for that
True.
point of view, I will say that yes, the kind of tele education or e-programs can be equally useful. But the only problem with that is that people have to realize, because we don't have the community or population. Acceptance has to be there. So once we have the acceptance, now you can see that from 4 months back to now people have started accepting the mask, the social distancing. The moment somebody coughs or sneeze, now we used to get separate from them. So this is
Yeah.
the thing which have come up in our mind. So similarly, in that way, the e-learning or e-education, that will take certain time, but definitely yes, in the next couple of months, it will be there in our system.
That's wonderful. And with this message, I think we should wrap up the show today. And thank you, Dr. Jatin, for joining us. Before we wrap up, we have